I'm going to talk about a case report of antisynthetase syndrome in a female patient. Well, antisynthetase syndrome is an autoimmune disease encompassed within inflammatory myopathies. It is characterized by mechanic hands, myositis, fever, interstitial lung disease, and other constitutional symptoms. The case of our patient is a woman of 48 years old with history of quadriparesia over 3 months of evolution, which was symmetrical and progressive. Also, she had painful paresthesias. The patient also had intolerance to solid food, anorexia, and vomiting, and history of fever and cough. When the patient was hospitalized, at the physical examination, we found icteric tegumentary findings and also hyperpigmentation of the oral mucosa, also fissures in the border of the fingers. We made a CT scan of the thorax where we found ground glass opacities, and we made endoscopy of the upper tract when we found hiatal hernia. Also we proceed to make the study of the antisynthetase antibodies, where we found positive the anti-Jo1, which was confirmatory for antisynthetase syndrome. The conclusions we had with this patient is that the muscle weakness was attributed with the antisynthetase syndrome, with many manifestations of this entity. The antisynthetase syndrome, as I talked about before, it's a kind of the inflammatory myopathies. The patient had a lot of things that we can relate with the antisynthetase syndrome, such as the mechanics hands. Well, the patient had not the classic mechanics hand, but she had the fissures in the border of the fingers. Also, she had a hematoma in the eyelid that remitted spontaneously, and also the patient had the finding of the interstitial lung disease, which was the ground glass opacities. The antisynthetase syndrome had good prognosis. The patients could be stable, but are subject to exacerbation.